Is there any real reason why we need different levels of EMS providers? Currently, the Department of Transportation regulates ambulance services and sets standards for who can provide emergency medical services. Some states will also allow standards for care provided inside their own state. North Dakota has 5 levels that it recognizes as EMS ambulance attendants. When people ask me why I ended up being on the ambulance, I tell them that my father, a paramedic, got me interested in this field of work. To be an EMS provider in North Dakota, you must either be a CPR driver, a first responder, EMT basic, EMT intermediate, or an EMT paramedic. Each level has specific duties and is closely regulated by a medical director, which is a doctor, and can do only what the doctor has given them permission and their protocols to do. Protocols are like instructions for treating a patient. The least trained provider is a CPR driver. This person is certified in CPR by the American Heart Association. They have taken a class that teaches you the proper steps in performing cardiovascular resuscitation alone with one other person on an adult, child, and an infant. In order to pass this certification, you need to take a written test and demonstrate on a mannequin how to do CPR, clear an obstructed area, and use an AED. An automatic external defibrillator is a computerized device that will deliver an electric shock to a person in sudden cardiac arrest. This is sometimes referred to as giving your heart a jump start, just like a car with a dead battery. A somewhat higher level of care is the first responder. A first responder is often the first person at the scene of an accident or an emergency. This person has taken a class for approximately 48 hours and upon completion can also drive an ambulance and perform CPR. In addition, a first responder can do basic life-saving skills like bleeding control and splinting of broken bones. They are trained to assess a person's condition and provide treatment with very little equipment. To be able to provide care alone in the back of an ambulance, you must be trained as an EMT basic. This is usually about 100 hours and involves more in-depth study of anatomy and how our body works, also called physiology. The emergency medical technician will have to pass the written test and a state skills verification. These skills involve providing rescue breathing with a vague valve mask, inserting airway adjuncts, splinting using medical traction devices, and treating patients for shock, administering basic medications for chest pain, anaphylaxis, and poisoning, and respiratory difficulty. The reason you have to pass a skills test is on an ambulance, you'll often have to be able to treat patients very quickly. The Department of Transportation determined in 1967 that injured patients survived and had the best recovery if it took no more than 10 minutes at the scene and that the patient was to a hospital less than 1 hour after the time of the accident. EMT intermediate must have EMT basic training and in addition take another course that enables them to perform invasive procedures like starting IVs, running fluids through the IVs, and placing advanced airways. These EMS providers will have more knowledge in how trauma affects the body and how we can stop it or even prevent it. As the training progresses in EMS, each level is given more and more responsibility. The highest level of EMS is a paramedic. Para is a Latin prefix which means nearly or around. So a paramedic is nearly a medic. Their training is from 750 to 2,000 hours. When completed, they have a basic understanding of many situations and illnesses and work very closely with medical control, which is a doctor in the ER. Paramedics have become the main caregivers in most ambulance services throughout the United States. Even rural areas now have paramedics in their ambulances. In addition to giving care in the ambulance, many paramedics will often teach the 4 other levels of EMS caregivers. This may seem odd having one level of EMS teach other levels of EMS, but it has been proven that the experience gained working your way up to a paramedic is often the best education. After explaining the 5 levels of EMS providers, I hope you can see why some people say we need different levels of EMS providers. Maybe you can also understand why the current cuts in healthcare and concern about medical spending, other people feel we don't need different levels of EMS. I know what my decision is, but hopefully I can give you enough information so you can answer the question for yourself. Why do we need different levels of EMS providers?